Okay. All right. So welcome, everyone. I want to thank you all for joining us today. And before we do get started, if you've noticed, I do want to let you know we are recording today's session. And we will have the recording posted within a few days on the AARP New Hampshire YouTube channel at, whoops, www.youtube.com/@AARPNH. I will be putting that link in the chat. My name's Mary, and I am your host from AARP New Hampshire for today's webinar. I am a lead AARP New Hampshire volunteer. Also joining me today is Sandy, who is going to help us out monitoring. And also is Ashley Davis, who is the AARP New Hampshire staff. She will be monitoring the chat. We want to hear from you this afternoon, so if you would like to ask a question or make a comment, please use the chat box, which can be accessed by clicking the chat button at the bottom of your screen. Because we are in a webinar, if you want, you make sure that you are posting your question to everyone. So at AARP New Hampshire, we are focused on the health, the financial security, and the social connections that are critical to the well-being of the 50 plus in the Granite State. We carry out our work through targeted advocacy at the state and federal levels with compelling engagements of the 50 plus community statewide and serving as a trusted resource for information for our members and the public. I have another link I will be putting in the chat with resources for healthy living. It's www.aarp.org/healthy living. Our presentation today is a great window into new skills and techniques that can help you prevent falls and improve your balance for overall health. Today, we are working with Donna Pigeon, a physical therapist who specializes in fall prevention. Donna has practiced physical therapy since 1986. She has a passion for improving balance, function, and quality of life for older adults. Donna co-founded the Balance and Vestibular Program at Dartmouth Hitchcock Medical Center, Dartmouth Health in Lebanon, New Hampshire, and the first Parkinson's Wellness Program at DHMC, and currently works closely with movement disorders specialists with the Parkinson's Center of Excellence of Dartmouth Health. Focusing on public health since 2000, Donna serves as co-chair of the New Hampshire Falls Risk Reduction Task Force, a statewide falls prevention coalition. We're so thankful that she's here with us today so that she can share her knowledge with us all. Donna, thank you for supporting community members with AARP New Hampshire, and we're grateful for your time and expertise today. And I will now hand this over to you. Thank you.
Well, thank you very much. Thank you for inviting me. I'm really excited to be here with all of you today. And as was mentioned, please do feel free to ask questions anytime. Or try to make this as interactive as possible, and I want to make sure I'm getting the information that's helpful to you. Um, so first, I'm just going to talk a little bit about data that we know about falls in older adults, and this is national data from CDC. So when we talk about older adults in research and data gathering, it's considered for people 65 and older. Probably a lot of the reason for that age is that it's based on a lot of Medicare claims data. So it sort of, coincides with that. But so if we look at adults 65 and older, we know that about 1 in 4 people will fall each year. We also know that about 3 million people visit emergency rooms due to a fall, and 1 million are hospitalized due to a fall. In 2021, there were 38,000 deaths due to falls. And it's the most common cause for traumatic brain injury and hip fracture for people 65 and older. And if you fall once, it doubles your chance of having a fall again within the same year. So we know it's a really critical public health issue because of the risk of injury or death and disability. And so we want to do whatever we can to try to help prevent that fall. And even though falls are really prevalent, we know that about 50% of falls are not reported to a primary care provider. So this number is probably even higher as far as the number of people who fall. And there are a lot of reasons that people may not report. And I'll often do these presentations with small groups and kind of get ideas from the public and from people who work with older adults. And so some of this may resonate with all of you, but the reasons can range from, it doesn't seem like a big deal if you didn't get injured, or maybe people don't want to start a slippery slope of tests in the healthcare system and figuring out what might be wrong, or maybe it's related to costs. Maybe it's a fear of loss of independence. Maybe some people feel that if they tell somebody that they're falling, that somebody's going to say they can't be doing whatever, can't be driving, can't be living where they're currently living, or, whatever the circumstance may be. Um, some people, so this is interesting. When we think about falls, we have to define it. It seems sort of obvious, but it's really not. So a fall is any unintentional contact with the ground or lower surface. So a fall can be skiing, a fall can be tripping over a garden hose, a fall can be tripping over a tree root hiking, or it could be just walking across your living room and you don't know why, but you find yourself on the floor, right? So it's a whole range of reasons, but that unintended contact with the ground is a fall. And some people think that just because we age, it's normal to fall. It's a normal part of aging, so it's just expected. But what we know is that though falls are common, it's not necessarily a normal part of aging, so it's not inevitable. And we also know that we can significantly reduce our risk of falling. So that's what we're going to talk about today is how can we reduce that risk from having that first fall, or, if we've had falls, how do we prevent that second fall or third fall from happening? So one of the things I like to do is just review our balance system. And that helps us, I think, when we're thinking about ways to reduce our fall and fall risk. So if we think about the balance system, it's very complex. It's more complicated than this slide shows. There are lots of arrows going back and forth to all the different functions, but we can simplify it in a way and think of balance as an input and output system. So we have our sensory system, various sensory systems that input information into our brain. Our brain processes that information and then tells our body how to move to stay upright. So then we have to have adequate work coming from our muscles and our joints. And so we break this down just a little bit. I'm happy to answer questions about this. Let me just get a uh, spotlight. So let's think about our feet first. Somatosensory. So information coming from the bottom of our feet telling our brains, are we standing on sand? Are we standing on a carpet? Are we standing on cobblestone? Are we standing on a hardwood floor, right? So depending on those situations, we have to react a little bit differently. Pretty common to have some sensory loss, not necessarily just with aging, but as we age, it's even more common. It could come from diabetic neuropathy, could come from neuropathy for any reason. Vitamin B deficiency, chemotherapy, nerve damage in the back. So not uncommon to have some numbness or tingling in our feet. So that can impair our balance. The inner ear vestibular system. As was mentioned, I work at the Balance and Vestibular Center. I could spend days talking about this system. It's fascinating, but I promise I won't. But what we need to think about here, this is our ear, obviously, our ear canal, eardrum. Sound comes in, hits the drum, drum vibrates, moves these bones, conducts sound through the cochlear part of the inner ear off to our brain. This part of the inner ear is the vestibular part. That is our equilibrium system in our inner ear. These canals are fluid filled. There's some additional material in this part of the vestibular system. There can be things that go wrong in the vestibular system. So some of you may have or have heard of things like Meniere's, whereas pressure issue affecting the fibers, nerve fibers in there. Some of you might have had positional vertigo. Sometimes shingles will hit the nerve in the inner ear. You could have an inflammation in the inner ear. So you can have pathology that makes us dizzy, and unsteady. We also can get just a weakness in that system. So this system is responsive to challenge. So think, dancer or ice skater, like we just saw in the Olympics this last year, how fast they spin around, right? And they don't fall over. Most of us, if we even started to spin like that, we would get dizzy, pretty dizzy, and fall over. But they've conditioned their system to be able to spin. Or, pilots, so some people really challenge that vestibular system to a very high level. We can also think of it in terms of like little kids, right? Little kids are always spinning and rolling and somersaulting, and they're really challenging their vestibular system. They could ride amusement parks all day long and eat whatever they want and not get sick, right? But most of us adults, if we were to ride amusement park rides, we don't tolerate them pretty. Like I can't ride a merry-go-round now, right? Because we just don't condition our system. But what will happen to impair us functionally is if we don't move in a sort of like typical speed and fashion. So if we don't feel comfortable just bending down to pick something up off the floor or turn quickly if somebody calls our name, if we're not looking up at the sky and, to see the birds flying, if we start limiting our movement or slowing down our movement, that system weakens. And then if it gets weak to the point of not being able to handle those normal quick movements, that can make us unsteady. But the good thing is, if we challenge that system, it will get stronger. Our eyes, our vision, right? We depend a lot on our eyes. Obviously, we can have things that can happen. We can have macular degeneration and glaucoma, just visual changes, cataracts, right? So we want to make sure our vision is optimized to get good sensory input. Brain, the great processor. So we need to challenge our brain in order to keep things working quickly and well. Things can affect our brain. We could have a stroke or a brain injury or Parkinson's. That doesn't mean it's, inevitably we're going to fall with those conditions, but we're more likely to fall. But we also can do things to challenge our brain to decrease our fall risk. And then our extremities and our trunk, really, that's not in here. So we need to make sure we have flexibility in our joints, knee joints, hip joints, trunk joints, so that we can move as we need to if our balance is challenged. We need to have strong muscles, and we're going to talk about this even more in a few minutes. This is really critical. Um, we as humans, this is a tremendously important message that I'd like people to walk away with from today. So we as humans lose muscle fibers over time. We can't do anything about it. We, build muscle fibers and then we start to lose them. And it might surprise some of you to know what decade we start to lose those fibers. If you just want to think about it, like think about a number in your mind right now. When you think we might start losing those muscle fibers? The answer is in our 30s. So much earlier than most of us think about losing muscle fibers. And really, most of us aren't going to notice it in our 30s. The people who do notice it are elite athletes, right? So people who need that extra high level of strength. Downhill skiers, sprinters, people who play team sports that depend on speed and strength. But what happens is that muscle fiber loss is exponential. So each decade, we have a dramatic increase in muscle fiber loss. The good news is, at any age, we can challenge our muscles. Our muscles are also responsive to challenge to increase our strength. So whether we're 20, 50, 80, 100, or beyond, if we do activities that work on strengthening our muscles, the muscles will get stronger. So it becomes critical once we hit our 60s or so to do activities to strengthen our muscles so we don't have functional muscle loss because we are going to notice our muscle fibers deteriorating or decreasing if we don't do things to keep them and make them stronger. All right, that was a lot of information about the balance system. We're going to start talking about risk factors and how we reduce our risk factors otherwise, but I just want to pause for just a moment to see if anybody has any questions about anything so far. Hopefully that all makes sense.
So I don't see any questions right now in the chat.
Okay, thank you. Okay, so if we think about our risk for fall, so we keep that balance system, keep the anatomy in mind, because some of that will pertain to this. Um, there's been a lot of research done. This study referenced here in the on this slide is um, meta-analysis study, but it really in the 80s, there started to be 1980s, a lot of studies looking at fall risk factors. And so this is a list that has been identified in the literature in terms of risk factors for falls. And it's divided into intrinsic, those risk factors that are within our body, extrinsic, the risk factors that are external to our body. And the risk factors that have the darker yellow background are completely modifiable. I mean, we can definitely do something about them. The ones that are lighter background are potentially modifiable. So we can really have impact on all of these potential risk factors for falls. And that becomes important because the more risk factors we have, the greater our risk for falls, which kind of makes sense, right? So the list on the left, postural hypotension, means that's when we have a brief drop in blood pressure. Usually when we stand after we've been sitting down for a long time or lying down, sometimes after a big meal. So we've probably all experienced this to some degree. Sometimes people get if they're squatting for a while and they stand up, people might refer to it as a head rush, right? That woof feeling. But it can become more common as we age because we lose the elasticity in our blood vessels in our legs that pump, that keep our blood going back to our heart. So things we can do to modify that are things like before we stand, if we've been sitting for a while, pump our ankles up and down, move our legs, get the blood pumping. Also stand up slowly, pause, and make sure that we're not dizzy before we move, and making sure we're staying hydrated. So if we're dehydrated, we have more likely chance of postural hypotension. And then also on that list, neurologic conditions. So we want to make sure we're maximally, intervening on any neurologic conditions that could be impairing our balance. Muscle weakness, we just talked about, dizziness, vision and hearing impairment, arthritis, frailty. So that's a condition where people have weight loss, fatigue, associated with decreased activity and decreased ability to walk quickly, gait or walking and balance problems. Okay. And then extrinsic, environmental hazards, the use of four or more medications. So I always, caution people, we don't want to stop any medicines, but the more medications we take, the more likely there's to be side effects and the more likely that there could be a risk for falls associated with it. Walking in barefoot, in socks, poorly fitting shoes. So we're going to talk about some of these things in more detail. Okay. This is a form. So this is on the bottom of the screen here. You can see the link to this website where this form comes from. CDC has a very good fall prevention website. And it's down here on the bottom, www.cdc.gov/steady, STEADI. Maybe we can just put that in chat if that's okay for folks. There's a lot of information. There's information for healthcare providers, but there's information for the public caregivers. It's just a wealth of information on ways we can reduce our falls risk. So I really do recommend that website. STEADY stands for Stopping Elderly Accidents, Deaths, and Injuries. I always joke they came up with a clever acronym first and then made the words fit, but it's their fall prevention website. So this is one of the forms. Um, and this is a way to assess potential fall risk. And so if we were just to say, like, if we were doing this, I might say, oh yeah, I have fallen in the past year. And if I put an X there, right, and then there's a two next to it, and you'll see that we're going to add up the yeses have either a one or a two next to them. So let's go down through and let's see, we're reading these like, oh, yeah, sometimes I do feel unsteady when I'm walking. And then maybe, yeah, I am kind of worried about falling, right? So say those are my yeses and everything else was a no. Those add up to four. And it tells us that if we score four or more points, that we might be at a higher risk for a fall. So it means that we need to pay attention to that. There's information on the right side of this form as to why it matters, right? So the first one, I have fallen in the past year. Why does it matter? Because people who have fallen are likely to fall again. And we mentioned earlier, it doubles your chance of falling again. So it lets you know as to why we need to pay attention to these things. So how we might begin to address our fall risk.
So Donna, may I ask a question that's
Of
in the
course.
chat?
Yes.
Um, Carol says that she has not fallen, but she has this fear when carrying her oxygen tank on her back that when she leaves home to run errands. So she wants to know if you have any advice for her or advice.
Yeah. So that's a really good question. And So I will say fear of falling is a risk factor for falls, but more in the like it sounds like that's a healthy awareness of potential of falling with the oxygen on your back. And so fear of falling is a risk factor because it can limit our activity. So the good thing is you're getting out with it. So you're not, the fear isn't so high that you're staying at home and not getting out because then you can get weaker and then you can increase your fall risk. So I guess the advice I would say is it's important to think about that because it does throw your balance off more. And there's obviously some tubing as well. So the advice I would have is to make sure two things. One is to make sure that you're paying even closer attention, moving slower, paying closer attention to your balance, particularly if you're in an area that could lead to a high risk. So going up and down stairs, right? So you're not going to fall on stairs. Pay extra close attention to the tubing to make sure it's, tucked in and not going to catch on anything and not going to trip you up. Um, and then depending on your mobility, you might, I don't know your activity level, your mobility level, but sometimes people do better in certain situations having an assistive device. And I mentioned this in a minute. So it might be a situation that you're using walking sticks just to give you that little extra steadying help. Or maybe you use a rollator some of the times, those wheeled walkers, and the walker can hold the oxygen and you don't have to have it on your back. So thinking about potential assistive device modifications as well that could help make those activities safer. And so you can still keep doing those activities. It's a great question. Hopefully that was helpful. And that advice of assistive devices, of potentially, paying that extra attention, because when we have divided attention, If we're going upstairs and we're thinking about whatever our task is going upstairs, that puts us at a higher fall risk. So whenever we're in a situation where the risk of injury is that much higher, a step stool, a stairs, we want to make sure that a good chunk of our mental focus is on the stairs. Make sure we're not distracted by talking to somebody else or looking around or doing something else at the same time. Yeah. So when we think about these risk factors, what we want to do is take action, modify as many of those risk factors as we have as is possible. So it's called multifactorial intervention. We're just going to intervene on all those risk factors that we can. Important within that subset is we must do balance and strengthening exercises or activities. Because remember, we're going to lose muscle fibers, and if we don't do strengthening work, we can get, considerably weaker. And we need to challenge our balance system, like I was mentioning earlier, it responds to challenge. So if we don't challenge it by working on our balance, that can get weaker as well. So, a couple things to think about. Medications. We mentioned that four or more medications can put us at a higher risk for having a fall. So just consult your medical provider and or pharmacist about medications that you're taking. Make sure that they're updated as they need be. Sometimes blood pressure medicine has to change over time or other medications that we're taking. If it's a new medication and you've coincidentally started feeling more drowsy or dizzy, making sure you're communicating with your provider because medications may need to be changed or modified for optimizing their effect without increasing our risk of being dizzy or woozy and falling. Um, I would highly recommend speaking with your medical provider about vitamin D supplementation if you are not already taking vitamin D. I wouldn't take it without consulting your provider. Sometimes people have certain conditions where they shouldn't take vitamin D, but the biggest way we get vitamin D is from the sun. And of course, we protect ourselves from skin cancer by using sunblock. So most of the time, we're blocking out what the sun's effect of um, of our vitamin D absorption, because what that does is increases the absorption of calcium into our cells. That's why we need vitamin D. We need calcium for all of our functions. We certainly need it for strong bones, but we also need it for strong muscles. So muscles need calcium to be strong. So we can get weakness from low vitamin D levels. And we don't tend to get vitamin D like we get other vitamins in the food we eat. There is some in some oily fish and some greens, but we just don't get enough. And especially with regards to the sun, where if we live in the northern latitudes, it's just not strong enough most of the year to give us the amount that we need, even if we were out in the sun for a short period of time. So something to consider. Of course, having our vision checked regularly, um, optimizing our vision, whether it's intervention or glasses. I will say that some people who have conditions that make them dizzy or are falling a lot for any number of reasons and have multifocal lenses, so bifocals, trifocals, or progressives. Some people do better with single focal lenses, even if they've been using those multifocal lenses for a while. Because if you have those other conditions and you're active in the community, having to look through the different parts of the lens can be very dizzying and throw our balance off. So something to consider. It's not something that everyone must do. The downside of it is then you might have two pair of glasses, right? Reading glasses and distance glasses, and you have to remember where both of them are and which ones are on at any given time. So there's downsides to it as well, but something to think about. Of course, we want to optimally manage our chronic conditions. So whether it's arthritis or there's neurologic conditions, heart conditions, blood pressure. So making sure we're getting regular medical provider checkups to make sure any chronic conditions we have are maximally managed. And then here's another huge message I would love to make sure people get. So we talked about the strengthening. Dizziness is something that needs to be assessed. There can be a ton of reasons for dizziness. It can be related to medication, it can be related to an inner ear pathology, it can be related to a central nervous system, so a traumatic brain injury or stroke. It could be related to that postural hypotension, right? So whenever we have dizziness, we want to make sure it's checked out. And if you've been through all the tests and the provider says, everything's fine. Oh, diabetes, right, can cause dizziness if it's low or high sugars. So if everything is managed medically, nobody sees a reason for it, I would highly recommend asking for a physical therapy assessment for people who PTs who treat people with dizziness because sometimes it's just that weakness that we talked about earlier in the inner ear. There may not be a disease process of the inner ear, but it's oftentimes we can help with the dizziness, decrease the dizziness with some exercise. Definitely, if you have what's called benign positional vertigo, where you lie down and the room spins for a few seconds and then it stops, that's a very common condition. It's called benign paroxysmal positional vertigo. Not important to remember that big long name, but it's important to remember that sometimes people call it the rocks loose in your ear, right? It's very common. Some of you on the call might have had it at some point in time. Um, that it's a like 98% very easy fix for somebody who knows how to treat that. So we definitely want that treated as well. And the biggest message here, many potential causes of dizziness, big message. Dizziness is never normal, right? So that sometimes people will think, oh, I'm older, it's normal to have dizziness. Nope, not normal. There's always a reason. So we always want to intervene, get that treated so that we're not dizzy, because that can definitely lead to falls. So I mentioned this earlier with the question. So assistive devices and shoes, right? So thinking about what we're doing, we might want to use something, right? So like trekking poles, if we're going on a hike or just walking around our yard, or if it's winter and you're living in a snow zone. Sometimes people have told me they worry that if they start using a cane or start using a hiking pole, they're going to start to depend on it, and then it's going to lead to a wheelchair, right? That's like our minds kind of go there. But I'm here to tell you that's not true. And you're much better off using a cane or using a hiking pole or two poles. If you're walking outside and you're feeling unsteady, use that cane, use those poles and do the activity, you'll be better off because you'll be stronger doing the activity and you'll be safer decreasing your fall risk. And sometimes, like I mentioned earlier, if it's like a longer distance, the rollators are those, pivoting wheel walkers. Like maybe you need them for all day tour in Europe, right? But maybe you don't use it all the time, but you might need to sit occasionally or have a little extra support on those cobblestone walkways, right? So just thinking about what makes sense for the situation can really make a big difference in safety. I mean, if we think about the hiking, 20-year-old hikers use trekking poles, right? It's going to help you accomplish that task and be safer with it. The other thing to think about is the shoes that we wear. So especially as we head into summer, some of the real easy slip-on flip-flops and Crocs and, clogs, those kind of shoes. If there's no back to those, so some clogs, although clogs can be high, we want to have them low, have backs to them, then hold them on your feet. But anything that's not snugly on your foot can be a fall risk because you can just get tripped up on them, right, more easily. So thinking about what's on our feet. And then environmental safety. So thinking about reducing those environmental trip and slip hazards. So here's a couple of examples, like outside clearing walkways, making sure there's good lighting going outside or and inside for that matter, the lighting. Make sure there's railing on your steps going into and out of your house, so you always have one hand that you can hold on to something. Um, in the house, making sure clutter is picked up so we're not at risk for tripping on something that's on the floor, especially on stairs, but anywhere. Using the railing on stairs, one hand on a railing at least. Making sure there's good lighting at night so you're not getting up and going to the bathroom in pitch black, right? So there's some kind of light that comes on or light that you're using or light that's on all the time. Potentially grab bars in the bathroom. We need to remember that towel racks are not grab bars. They can collapse easily. So making sure they're grab bars that are installed properly and fix to the walls. And there's many more things to think about for environmental safety. The link that's here, I think, believe is in chat as well. This is a link to our New Hampshire Fall Risk Reduction Task Force, which is our statewide falls coalition. Um, and we have a lot of information on the website. And one of the things we have is a PDF that you find on this link that's set up by room. And you can print it out and go from room to room and just get some ideas on how to make all the rooms and outside safer. Also, on that Steady website that I mentioned earlier, there is it's a smaller, not as detailed home safety assessment, but there's one on the Steady website as well. Questions about anything so far? Or thoughts or comments? I didn't mention winter. We're heading out of winter for sure, thankfully, finally, for those of us in winter zones. But winter, also think about the extra, obviously making sure that walkways are cleared from the snow and ice, but then also considering those spikes that you can put on the outside of your boots, as well as having a trekking pole or a ski pole you can use, but something that can dig into the snowy pathways as well.
So we have no questions right now, Donna.
Okay. All right. And so the balance is strengthening. So I mentioned earlier, so, intervening on all those risk factors, but also super, super, super important, doing exercise or physical activity that can reduce our fall risk. This is a key. So the keys to exercise is we must include balance and leg strengthening exercise. And we'll talk a little bit more about that in detail, but it's important that we feel a challenge. So to know if what we're doing is doing any good after we do some exercise or physical activity, we should feel it. So we should feel like our muscles are a little fatigued, right? Like we feel like we did something. If we don't feel like we did something, then it's probably not getting having a strengthening effect. And I like to give the example, like if I'm just touching my shoulder, so I'm bending and straightening my elbow, my biceps, my upper arm muscle is strong enough to do this pretty easily, right? Now, if I had a stroke or something and that was hard for me to do, and I felt tired after touching my shoulder 10 times, I would be working on strengthening. But if I don't feel anything, if I feel like I could do it all day. If I want to get my biceps muscles stronger, I would hold a weight. So maybe holding a 5-pound weight and doing it 10 times. At the end of that, I was like, okay, that muscle's getting a little tired. Then I know I'm having a strengthening effect. Okay. Approaching it from functional activities is always helpful. We do know separately, and I'm going to talk about a Tai Chi program, that Tai Chi can decrease falls risk. So there's been a lot of studies around Tai Chi programs in and of themselves. The goal with exercise is to make it a regular part of your life, right? And remember how I mentioned earlier that just once we hit particularly our 60s, we're going to notice a decrease in strength if we're not doing activities to keep our muscles strong and increase their strength. So we just have to keep doing it, make it a regular part of your life. The more we do, the more we can do. So, if we do strengthening, if we do like a set of strengthening exercises, we want to ideally do strengthening work 2 to 3 times a week, giving yourself a rest day in between exercise, which doesn't mean you can't do, like you could do your set of exercises on Monday and do some gardening on Tuesday, and that's still going to be working on your strength, but it's okay to do that. But giving yourself a rest break from the actual exercise routine is recommended. We don't want to push into any pain ever. We might feel lame. Our muscles might feel a little lame after doing something new. That's normal. And then the more we do it, the less lame we would get. But we want to make sure we're not getting joint or nerve pain with our exercise. Doing a couple of sets, 8 to 12 reps. And again, the important thing is that at the end of those sets, we can feel that our muscles have done something. So we can use exercise equipment, right? Some ideas here, some machines, some cuff weights. We can also use gravity to give ourselves a workout. So the upper left photo shows somebody just going from sit to stand, sit to stand, sit to stand. If we did that 10, 12 times, all of us now, I bet we would feel it in our thighs. And that's good. That's a way we can work on our thigh strength, right? Without having to do going to a gym per se, but we can do that as an exercise to increase our strength. Same with the bottom right picture, going up onto our toes. So exercising our calf muscles, right? We can do it on one leg or 2 legs, holding on to something, but just going up and down onto our toes is enough against gravity to get some strengthening there. And we'd always want to do toe lifts as well, by the way. So if we did heel raises, we then want to do toe raises. So on our heels, lifting our toes up so that we make sure we keep our flexibility in our calf and our strength to lift our toes so our toes don't catch on something and trip. Balance exercises. So we can do exercises at home. We can do exercises in a part of a class. You can do balance exercises every day. There's no rest day recommended necessarily. And again, our balance needs to be challenged. So if we think about standing, and if I just stand, if that's easy for me, I'm not challenging my balance. But if I stand like this upper right picture with my feet narrowed, my base narrowed, or the bottom right with the woman standing on the foam and lifting one leg, that's going to be harder for me to do. I'm going to have to work to be able to hold my balance. So that will challenge my balance and make it stronger. And the bottom left picture is an example of something we can do, as I mentioned earlier, challenging our inner ear vestibular system is just walk down your hallway, look left, look right, look left, look right. You can look up and down. That's working the vestibular inner ear system. You can look on a diagonal up over your right shoulder, down past your left hip, and then vice versa. If we do exercises like balance exercises like this, standing near a wall or in a corner or at a counter so that you can hold on if you need to, if you start to lose your balance. So you want to make sure you do it in a safe way. And then the Tai Chi, the upper left picture. So again, that exercise in and of itself has been found to improve balance and decrease fall risk. And I'm going to talk about a program that I work with, Tai Chi Chuan Moving for Better Balance. That's a evidence-based program that incorporates Tai Chi. Questions? Okay. So depending on where you are in the country, there are many evidence-based programs. And these are programs that have research or some type of evidence behind them that show effectiveness in reducing falls or fall risk. This is an example of 3 of them. There's a full list on the NCOA website, and there's a link down there. If you just go to the NCOA, NCOA.org website, if we want to just throw that into chat, and then put in the search evidence-based fall prevention programs, you'll see the whole list, or we could put this whole link in the chat. Um, but um, so if you could look, usually they're at senior centers, through AAAs in your area, YMCAs, various rec centers, various places in the community will do these evidence-based programs. So you can look for what might be in your area. These three happen to be in New Hampshire, where I am. Um, and but they're all over the country as well. So the first one, Tai Chi Chuan Moving for Better Balance. It says it's a AAEBI physical activity program as well, as does Enhanced Fitness. What that stands for is Arthritis Appropriate Evidence-Based Intervention. So there are not only evidence-based fall prevention programs, there are evidence-based arthritis programs. And these are programs that are helpful and safe for people with arthritis in improving strength and activity. So the TJQMBB, as we call it, Tai Chi Chuan Moving for Better Balance, reduces falls by 58%, injurious falls by 75%. So tremendously effective in reducing falls and fall risk. And if you have Parkinson's disease, it reduces falls by 67%, as well as improves strength, balance, and function. And it's been shown to slow cognitive decline as well. Enhanced fitness improves strength, balance, and physical activity. Those are both physical activity programs. So the blue background, those are physical activity or exercise programs. The lighter peach background, A Matter of Balance, is primarily a discussion-based program. It's a 8-session program, but they do incorporate some beginner exercise. And it's been found to decrease fear of falling and increase physical activity in sedentary older adults. So just briefly, enhanced fitness can be done at any level. You can do it in sitting and standing. Again, it protects against falls and fall injury. And this is the routine. So it's basically a warm up. There's some aerobic or cardio exercise and a cool down from that. And then there's some strength training. So kind of what we would think of like a typical exercise class might look like. So some weights for strength training, some stretching, and then some standing and walking balance. So it's delivered for an hour, 2 to 3 times a week for 16 weeks. The Tai Chi program, Tai Chi Chuan Moving for Better Balance. Again, research-based program. I went over the tremendously effective in decreasing falls, also improving the strength, balance, and function. This is also delivered twice a week. It's a 24-week program, and it's 24 weeks because that's where the developer, Dr. Fuzhong Li, who is shown in this photo, has found that meets that statistical significance for reducing fall. And in this class as well, there's standing, stepping, and seated exercises. And the website for that is there, tjqmbb.org. If you're interested in the Tai Chi Chuan Moving for Better Balance, and depending on where you live, if you don't see something right in your community, please feel free to reach out to me and ask if there's something in your area, because um, I work closely with all of the trainers across the country. I'm an authorized trainer in this program, so I train instructors to teach this in the community. So I can often help link you with somebody in your area if you're interested in this program. And this just describes there's forms or choreographed movements. There's variations on those forms, so seated, standing, and chair assisted, which means holding on to the chair. And then there's some additional exercise for sit to stand, stepping around chair, for example. So incorporating some Tai Chi movements with typical other exercises that we might do. And all of the exercises are geared toward improving functional activity. So here's an example of like reaching for something high or stepping up into a shower. So those are a couple of examples of the evidence-based program. I want to pause for questions because I have this video that's like a 4-minute video, I think, that is a story of Sandy talking about a matter of balance and then Tai Chi Chuan moving for better balance. We can look at this video if people like. I think it's a moving video, but I want to pause and see if anyone has questions before we do that. So I want to make sure to get questions in.
I don't see any questions right now.
Okay, I hope that means people aren't bored. Think of questions. If you have any questions or anything you want to share, please do. But okay, so let me just play this video then. I just love this. So Sandy, I know her well. She's from New Hampshire. She's from the northern part of our state in the White Mountains. For those who are from New Hampshire, the North Conway region. And she's telling her story. And some of this story may be familiar to some of you, but I think it's a really powerful story. And it talks about these a couple of these evidence-based programs as well. So I'm going to go ahead and play this. Please let me know if you can't hear it. Hopefully this works.
My story begins in 2009. In the fall of 2009, all of a sudden my back went. I'd had 2 previous laminectomies and I couldn't move. And tried different things and it didn't work. And finally I had surgery in February. I ended up with a cane and I was constantly falling. Then in January 2015, January 20th, I took my little dog, 10-pound dog, outside to go potty. I had slippers on, and she started to fall, and I ran to get her. And of course, I didn't get very far. I get down on the ice, and I broke my femur on my right leg. I went to rehab. I had 3 months of private physical therapy, and I was still on a walker. I still couldn't walk. It was so frustrating and it just wasn't fun. I didn't go out of the house. I was like, I became very down in the dumps and my walker became my friend and I hated it. My daughter found an ad in the paper about a better balance course. And she said, I think you should try it. And I, not very nicely, said, oh, come on, Kate. Tried everything else. What do you think stupid course on balance is going to do? And she said, well, just try it on. So I went, toting my little walker, and lo and behold, it did really good. About 4 weeks into the program, it's an 8-week program, I was using a cane. And I thought, whoa, this is pretty good. That ended. I went down to the Jersey seashore. I walked 10 miles on the boardwalk because it was old car weekend and I didn't want to miss any of the cars. And I thought that was pretty good. I hadn't done anything like that in years. There's something about this program that teaches you to think as you're doing and not just take it for granted. That's what I think we need as we age. I think we need to keep in tune with our bodies, and we don't.
One of the success stories we've had from this program is Sandy. She gained that confidence to be able to know what to do, and she was no longer as fearful of falling. She's gone on to be a coach for the program, and as well as participating in the next program that we have, which is Tai Chi Chuan. And what it does, it helps people kind of get off balance and then get back on balance, so that you're learning what you need to do, that if you should start to lose your balance, you can regain it and you're less likely to fall. That's really powerful.
The first day I said, this isn't me. I'm not a yoga person. I don't do Tai Chi. I'm not an earth muffin. And now I am an earth muffin. I took the Tai Chi within about 2.5 months. I didn't even use the cane, and that was the middle of winter. And it starts very slowly. It starts with just, like swaying your ankles, learning to feel your muscles. And you do feel them. And they don't hurt. It doesn't give you pain just recently, I was certified. Well, last April, I was certified in the Better Balance, and now I just was certified in Tai Chi about a week and a half ago. Because I want to teach, I think people should, I want them to be able to be as mobile as I am, to be able to realize they can get up and move. I wasn't able to, and now I am. I can walk, I can go shopping, I can do all the things I like to do. I'm free. I can do what I want to do. I don't have to sit in that foolish house and feel sorry for myself. I really, really didn't think it would work. And then I took these courses, and now I am here again. And I'm me again.
All right. I get emotional still every time I see Sandy's, and she's still many years later, doing volunteering to teach these classes in her community. And then one last quote. So this woman in the foreground, Gladys, is somebody who came through one of our classes as well. And this was a quote from her that she, at one of the events we had, I was able to take control of my life and do something about my balance problem because of Tai Chi. I'm not so scared to try things. Tai Chi was my first step in getting healthy. All right. I'd love to hear what people thought about the video as well. So that's the presentation. So any thoughts, questions, comments?
So people, just so you know, Donna, we're not bored. They are finding this presentation to be very interesting, and they're really glad that you are giving them all this wonderful information.
Great. I'm glad to hear that.
Okay, I do see one question where if someone does fall, do you have suggestions for how to fall to reduce risk of injury?
That's such a great question. Yeah, if people have looked at that. There have been some European studies, Scandinavian studies, who they like have a falling class to train people how to do that. Um, I would say in general, in general, you want to, if it's like like you've tripped on something and you're down before you know it, you can't really plan on what you're going to do. But people who do well kind of can roll, will try to like roll onto a side. You want to basically protect your head is the biggest thing, right? So if you're coming down and going forward, you want to reach out with your hands. If you at worst fracture your wrist, you're not hitting your head on something. But there's not a lot of good data that show about practicing falling and decreasing injury. It's more like doing some of these exercises that are going to improve our balance reactions so that we would keep ourselves upright should we go to fall. But that's a super great question. And then I saw about getting up from a fall, and definitely getting up from a fall. You want to, first thing you would do should you fall is to make sure that you are not injured, right? Kind of get yourself together, emotionally, and then the best you can if you're able to get to something sturdy, if you're scooting or crawling, if it's a sturdy chair or something sturdy, and getting yourselves to hands and knees and then up on one knee, holding on, and then turning to sit in the chair is the ideal way if you have those things available. I will say a lot of people are also, if you're at a high risk for fall or falling or worried or even not, even just anybody, um, there are those life alert companies out there where you can wear like something around your wrist to call for help should you need it. But also a good idea if you're out and about on a hike on your yard, have a cell phone with you should you need to call for help. Also, a lot of people wear those smartwatches now, right? And a lot of them can detect fall, or again, you can just call for help. So, sort of planning ahead to should you fall, getting help as you need it, because that's another thing associated with more serious injury is not being able to get up once you fall. So you want to get help right away if you can't get yourself up. And we'll always tell people don't be shy about calling EMS, calling 911. People would much rather come help you up and everything's okay than not call and then get into trouble. So, yeah. Anything else?
I don't see any other questions in the chat. Lots of thank yous coming in now. So thank you so much for all this information, Donna. It's super helpful for everyone here who listened and everyone who will see it. Folks are welcome to reach out to AARP New Hampshire if you have questions, and hopefully we'll be able to keep connecting with Donna and keep everybody safe and healthy out there.
Absolutely. And please don't hesitate to reach out to me as well if you have any questions. And yeah, happy to help in any way. Well, thank you again so much. It's been fun. It's been a great opportunity to be able to connect with you all. So thank you.
Awesome. Thank you so much, Donna. Thank you, volunteers Mary and Sandy, and everyone have a wonderful weekend.
Thanks.